the last 25 years, I've had the privilege of interviewing and highlighting some truly interesting people. Everyone who is anyone, both the famous and the infamous, from presidents and their first ladies to kings and queens, movie stars and pop stars, captains of industry, heads of state, sports personalities, innovative entrepreneurs, and some pretty fascinating everyday people. Today, I am very proud to introduce you to Kathryn Froiland, an oncology nurse educator who has married her desire to educate people with a clinical component to become a respected professional in the healthcare field. Kathy, I am 100% committed to educating women, especially about women's health. So I want to start with the basics. How did you get your start in healthcare?
Oh gosh, that was a long time ago. I've been very fortunate to have a long career. I was always interested in science and learning and working with people, wanting to help, all those kind of little girl type of desires. And through educational opportunities, I learned from people I associated with. I had an idea in mind of something I wanted to pursue, but once I did enter my baccalaureate education program, I had the opportunity to learn more about nursing. And my grandmother had gone to school to become a nurse and then had to leave her program because she was needed at home in those days. And I had some other relatives who were nurses, but I did not come from a long line of healthcare providers, not at all. And it seemed to be a good fit as something that I wanted to pursue. So I entered or began taking classes in preparation for some of the specific nursing training classes. And once I got to that point, I knew I'd found the right path. And so there were challenges, of course. There's no easy way of when you're trying to pursue something that's demanding, but I was very fortunate to be in the right place at the right time. So that's how I got into it.
So, Kathy, I have to tell you my bias. I'm a heart disease survivor, and I spent several days in the hospital in intensive care, recovering from open heart surgery about 11 years ago. And I acquired the greatest affinity for nurses at that time, because although the doctors and the clinicians really did, in fact, save my life, obviously, with the life-saving research and the life-saving surgery, the nurses are the ones who help give you your life back. Yes. And they help get you to a place where you can now take over your own healthcare. So I'm passionate about nursing. So as a lifelong nurse, what makes you passionate about your work?
Wow. I think the thing that keeps me going, keeps me interested is I'm very pleased and really feel fortunate it's been an honor to be in the positions that I've been in where I can help others regain some normalcy in their lives or learn a new task or really deal with some pretty life-changing events that really it draws a lot of inner strength lots of times, and to witness some of that and to have some influence on helping them kind of grab onto the life they want and be hopeful about the future. I think nurses really have a big part in that. When you said the bit about doctors saving your life, I was party to a discussion one time, and it was a surgeon that I worked with, and it was a social gathering, and his wife asked me what I did. And he right away jumped in and he said, "She's the person that makes what I do work."
Oh, yes. I couldn't agree more.
Yeah. And I thought, Yeah, it's simply put, but that's it. I think the nurse is in the position to be there to go step by step rather than kind of zoom in at a particular point in time and with some consistency or routine. But the nurse is the person that stays with the patient and walks with that patient each day, each step of the way, and is usually the first person that the patient calls, because he or she knows that the nurse can accomplish what they need done.
Right then and there, and take it from a former patient and a lifelong advocate for nurses. I thank you very much for your service. Kathy, I see from your resume that you've had some variation in the types of nursing work that you've actually practiced over the course of your career, but you spent a great many years as an oncology nurse educator, as I said during the introduction. Why oncology, first of all?
Early on in my I had some experiences with other specialty areas, but then, as luck would have it, or as the fates provided, I was working with a group of patients who had leukemia, and early on in my career, in my early 20s, and as you know, leukemia affects people of all ages. But we also had many people our own age that we were caring for, and people that were preparing for bone marrow transplant or hoping at the time to be eligible for a bone marrow transplant. And it was really kind of a grounding experience to, certainly you faced your mortality, but also to witness the hope and the dreams and the desires, and to become part of that, being swept up into that, and seeing people with, the rawest of emotions, and being able to help them deal with the challenges that come with that.
Nursing in the oncology department can be very stressful mentally on the nurse, because when you are in oncology, obviously you're dealing with people with life-threatening illnesses on a regular basis. Yes. But I know there has to be, in addition to those trying times or challenges, as you've pointed out, can you share any stories or memorable moments that you experienced during your career as a nurse that left you hopeful, left you happy, and convinced that you had made the right decision?
I remember one young man that I had an opportunity to get to know, and he was diagnosed with leukemia, went through treatment, had a horrible time, was in the ICU, and we always kind of knew that once you went to the ICU, especially if you were put on a ventilator, you didn't usually survive that. But he did, and he got through that, and he looked like he had beaten up and left by the roadside when he got through all of that. And but he maintained his positive attitude, and he stayed really hopeful. And he got to the point where he was doing much better, and he did have a transplant donor, and his medical team was somewhat reluctant to go forward because of the difficulty he had. And they told him that, you probably have about a 5% chance of getting through all of this. Mm. And he said, 5% is better than nothing. I'm going to do it. And he just sailed through that treatment and did very, very well. So the odds were against him. And we all wanted him to move forward, enjoy his life, have a chance at living, and, just a normal life that everybody wants to have, and kind of, you take for granted until something huge like this happens. But it was so heartwarming, and I really felt, and so did the people I worked with, like we had accomplished something to whatever little portion of his care we had taken part in, to support him and to help him with the goals and the desires he had.
How wonderful. That's such a wonderful story. And again, as you said, very heartwarming. So, Kathy, what do you think is the most valuable piece of advice that you gained throughout your career in healthcare?
I think to be a lifelong learner, to take advantages of opportunities that come your way, to put the fearful voice, that voice like, well, you're comfortable, you're good at what you do, and kind of think, well, but I'd like to learn something new, and to be not to be afraid to take on a new challenge. So again, the lifelong learner attitude.
And I need to toot your horn a little bit here because I understand you were nominated for an award by MD Anderson's Cancer Center. Tell me a little bit more about that and bravo.
A woman who was she had worked much of her career at MD Anderson. She'd been a supervisor, one of those people that had tremendous experience and knew everyone and knew how to get things done. So it was really an attribute, or really a great honor, to be recognized as someone that was somewhat reflective of her career. And her name was Ethel Fleming. And every year they ask for nominations from throughout the house, whether it's the inpatient area, the outpatient area, anyone who's a nurse. And it's usually someone who's a care provider. So yeah, it was a tremendous honor to be nominated for that.
Bravo, bravo, bravo.
Yeah, I wanted to mention another award that I did receive, and that I worked for several years with the gynecologic oncology department. And MD Anderson has a training program, or a fellowship program, for physicians that want to specialize in GYN oncology. And one year, there were the three women who were the fellows of graduating that year gave me an award that recognized my patient education expertise. And what made it extra special was they wanted to give me that award. This was something they came up with on their own. It wasn't something that had to be given every year, but so that made it special. But they recognized my my input in their education as also. So, and I see one of the women stayed in the Houston area, and I see her occasionally, and she still holds a special place in my heart. And I love to see what she's done with her career too.
Fantastic, fantastic.
Yeah.
And Kathy, as we come to a conclusion, I always like to ask, what is the one thing you'd like the viewer of this video feature to actually walk away with? Since we've spent a little time just going through your personal and your professional life, in terms of what has made you the kind of nurse and healthcare provider that you are.
I hope people get some sense of that, and what a great career choice it can be. It can be, if you're interested in the intellectual side of things, there's plenty of things to become an expert in. There's always something to learn, but also the passion for caring for people and caring for those who really maybe at the rock bottom point in their lives and so afraid of what the future will bring, and really how long their future may actually be, and how influential a nurse can be in guiding a person, in addressing their fears, and helping them to reach that point where they realize that maybe life isn't normal anymore, but the new normal isn't so bad after all. And so that I think, you have to be someone who is passionate and willing to put the time and the energy and the mental fortitude in. And it can be very emotional, but it's also just, I don't use the word awesome very much, but working with people and seeing how awesome they can be and take on challenges, and that inner strength has really been an incredible privilege for me. And I'm grateful for that every day.
Thank you so much, Kathy. It's such a pleasure to meet you and to hear someone who is passionate about helping other people. You've dedicated your entire professional career to helping others and teaching others how to help others, which is really and truly something to be proud of. And I read this quote in preparing to chat with you today, and I think it really does summarize who you are. Nurses are the heart of healthcare, and I truly believe that that is the truth. So, Kathy, it's been a pleasure to chat with you, and thank you so much for sharing your passion.
Thank you, Star. I really appreciate it. Thank you very much.